Millions of Americans depend upon NAPH hospitals for their health care. We also know that millions of Americans are out of work, don't have health insurance, are really looking for a place to get high-quality care in their community. It's going to be important to make sure that NAPH members have the resources so they can do this, so they can continue to be the high-quality safety net across dozens of American areas, towns, villages, and cities. I plan to be a tireless advocate for the people who depend on NAPH hospitals. We're going to be here in Washington and state capitals really telling the story about how critical it is that NAPH members be supported. It's not so much about the hospitals, but it's really about the millions upon millions of Americans who depend on them day in and day out. Depend on their emergency rooms, depend on their physicians' offices, depend on the hospitals. These things are critical assets in just about every American community, and we've got to tell that story far and wide. After health reform, we're going to need the safety net more than ever. 35 million Americans are about to get a health insurance card, but unless there's a doctor or a nurse in their community, some place for them to go, it's not going to mean much. If we look at our cities and our metropolitan areas all over the country, we find that the one thing that people are going to have is an NAPH member. Those members will be more important than ever in taking care of these Americans who will now have health insurance for the first time. It's also really important to realize that a lot of those Americans won't have English as their first language. They may come from other countries, and it's really the NAPH members who are best equipped and best positioned to take care of many of these the insured Americans. Some of the leading health systems in America are members of NAPH. They've already done things like build primary care medical homes where people can get high quality services from doctors and nurses in their community. They've been leaders in things like adopting electronic medical records, something that the whole country is going to have to do. Some of the best practices in American healthcare are in NAPH's members, and our job now is to make sure the whole country can learn from that and knows about it.